If we had access to detox and residential, we could help a lot of people even more.
Expanding access to care could go a long way to addressing the drug crisis so many of us see playing out on our streets. Oregon lawmakers have a chance to do just that. The state ranks near the top in addiction rates and at or near the bottom for access to care. I spoke to one Senate Republican willing to work with Governor Kotek to fix the problem.
You like multiplayer, though? Yeah. We're doing 1v1.
Every day inside 4D Recovery in Southeast Portland, you'll find people days, weeks, months, even years into recovery for a substance use disorder.
We accept all pathways to recovery.
Sarah Schindlebeck is a peer mentor helping people maintain that path to recovery. We recently met her with one of her mentees who recently got out of residential treatment.
I met her when she just went into residential, and I've been able to watch her repair her life, and it's been an awesome thing to watch.
Measure 110 money pays for Schindlebeck's position. The voter-approved legislation decriminalized small amounts of hard drugs and diverted millions of dollars in cannabis taxes to treatment and recovery services.
And a little bit of recovery housing, peers. And so that's what 4D does, is this part.
Tony Vesna runs 4D Recovery. He says Measure 110 money has, so far, allowed them to serve over 230 additional people. However, Vesna says his peer mentors, the people who go out and interact with drug users, could do so much more if Oregon had adequate treatment and detox beds.
What we've been experiencing with our mentors is they go out, they can engage people, they can, be like, right, I really want to help you. I see you got this drug thing going on. Can I help you? And people are like, yeah, absolutely. And then we can't get them into the next level of service that they need to help them move along. So they're kind of just like stuck. And we end up just like having them stuck in our cars with nowhere to go and stuff like that. And it's really unfortunate.
A prior K2 News investigation found Measure 110 dollars don't pay for things like inpatient treatment or detox for people who have insurance. A 2022 study by OHSU found Oregon has a 35% shortage in outpatient treatment facilities, a 60% shortage for inpatient treatment, and a 27% shortage for residential detox facilities. Oregon is at or near the bottom of the U.S. for access to treatment. Republican Senator Cedric Hayden is the vice chair of the Senate Health Care Committee.
The legislature definitely has within their authority to make policy changes to where we could increase that. We just don't.
Oregon Governor Kotek's office told Katu she wants to expand access to treatment. In her recommended budget she gave to the legislature, she has money directed at supplementing Measure 110 programs. It includes $15 million for startup costs for residential detox, inpatient treatment, and recovery community centers, $127.4 million for increased wages for behavioral health workers, supplemented with federal matching dollars, and $60 million for loan repayment, scholarships, and tuition stipends for certain health providers and students. Hayden says it's a topic he's willing to work across the aisle with Kotek on. He hopes others will as well.
It just isn't a priority here in Oregon to do that. It's almost like we'll decriminalize everything, put it to the side, we'll make it voluntary, but the problem continues and grows.
Hayden says he'd like to see even more funding towards expanding treatment and detox. Easier access means more chances for people to get off drugs and turn their lives around. More people who can say this.
My recovery, I've stayed 18 months clean so far.
Well, no one should be living outside because they can't afford or can't find a place to live indoors. And it has an impact on everyone. If you're in a community like this and you're living, and I was checking when I was at the Navigation Center, and quite a few folks have been living out by the river. That's gotta have environmental impact. It is better for everyone, the environment and for our community safety, for people to be in homes, and that's what we're working towards. So I wanna make sure that people can get into shelter, get connected to services. Sometimes what they need is mental health or addiction services, and then they can get stable and get into permanent housing. None of these things are separate. They're all interrelated.
This is just the second stop of the governor's tour. Again, she's planning to visit every county in Oregon during her first year in office.